Good afternoon. We're just going to give people a few more minutes to jump on, and we want to make sure that you can also see our screen, so hang with us tight. All right, we are going to get started. So welcome to the Chicago Coordinated Entry third quarter community check-in. This webinar will be recorded, and before we get started, we just want to orient you to some of the functions that we'll be using in the GoToWebinar. So on the right-hand side of your screen, you should be able to see a section that says handouts. There are 4 handouts for today's check-in. You should be able to see the slides in a PDF version and some additional visuals that you'll see throughout the training, plus some protocols that we're going to go over. So if you like to multitask and want to get into the handouts during the presentation, feel free to do that. Also, we are going to ask you to send us questions through the chat function, and that's also on the right hand of your screen. So please feel free to send messages to us during the presentation, and we'll do our best to answer some questions throughout and at the end. Also, there's a way that you can send messages just privately to us, or you can send to all, and so we encourage using both functions depending on your comfort level. So with that, we are going to get started.
Wonderful, and we'll start with some introductions. Hello, friends. This is Stephanie Seidman from CSH.
I'm sorry, and this was Renee Crollia speaking from All Chicago.
Hi, I'm here too. This is Liza Duchesneau from the Center for Housing and Health.
Hi, and this is Anna Carvelin from All Chicago.
And welcome to everyone who joined us today. We're so happy to have you. Just a quick rundown of our plan for this hour. Certainly we wish to greet you and get to know a little bit more about you. Our topics will then focus on the coordinated entry assessment strategy, prioritization update, our brand new transfer policies that have not yet been implemented, and the coordinated entry accountability plan. We'll leave space for your comments, questions, discussion, feedback at the end, though you're welcome to chat in at any time. So to begin with, there are quite a few people joining us. Thank you so much. What is that number, Renee?
104.
104. We're thrilled to connect with everyone and would like to ask you to go to the chat box and share something about yourself that you wouldn't mind everyone hearing about you. It really could be anything at all. If you're just willing to chat and to say hi, we'll be thrilled. But if you'd like to share, if you happen to have a hobby, if there's a particular film that brings joy to your heart, if you have a certain quote that means something to you, those are just some ideas. But if you don't mind, just go to the chat box. We're just going to spend a minute or two asking folks to go ahead and say anything. And other folks are invited to read what other people are chatting in once you've offered something to the group. So Diane O'Connell writes, quote on her wall, might be at home, might be at the Coalition for the Homeless, we're not sure. The light shines in the darkness, and the darkness has not overcome it. Aaron Neal writes in, housing is a human right. I'm going to shout out over to Thresholds, as long as we're on Thresholds, that General Hospital is a great show, Ashley. Thank you. Thank you for making that point. Sherry Allen Reeves is sharing that she started working in the field when she was 7 years old, 30 years ago. Maybe not exactly, Sherry, but I'm paraphrasing a little. And you're too young for 30 years.
Kathy has fostering a pregnant cat, so thank you for that work.
That's beautiful. Oh, we're getting some boy band shout outs. So this is just terrific, terrific. If you haven't had a chance to chat in, please feel free. We'll go ahead and move along. And if you haven't had a chance to read everyone's chat, please feel free to multitask. It really is lovely being in community with all of you, and we're happy with anything you wish to share. I think Renee is laughing because a tag sale just made the update list. If an address makes it, perhaps we'll all see each other in person there.
Ooh, oh my goodness, this is amazing. Thank you. Keep sending those in. Oh, we did see an address.
Wonderful.
All right.
Hi, everyone. Well, with that great introduction, this is Liza speaking. I'm going to do a rundown of the assessment strategy that I'm sure a lot of you have heard about, but I want to give some more information for you on this, what's to come. So first of all, I'd like to just extend a giant thank you to the whole community. Over the last couple of years, skilled assessors at agencies who have taken on this responsibility of doing assessments have assessed close to 20,000 households for housing. And of those, 22,400 households have been connected to housing through coordinated entry, which is just a giant feat. And we really could not have done this without everyone who was involved in coordinated entry over the last 2 years, which have included 70 agencies and over 300 people playing the role of skilled assessor. So thank you, thank you. As you have heard, we are moving into this new strategy, which includes adding supports. And so we've already started onboarding dedicated skilled assessors who will be located at the call center and have support the access points and floating to different shelters that need extra supports. And so through this process, we're always evaluating what shelters need more supports, where in the city we need access to coordinated entry, having discussions with partners and learning about workflows at different agencies and what might be needed that might be unique to your specific project. And then making adjustments as we see fit and as your requests come in and we have those conversations. This definitely can't be done without community input, and it's an ongoing process. So we'll see some changes in 2019 and then ongoing through 2020 as we learn more about what our community needs. So this is a visual just to help shed some light on where we've come from and where we're moving forward. So as you might recall, in 2017 in April, we started off with the veteran pilot program to kind of introduce us to coordinated entry, and then all populations had access to coordinated entry resources in September of 2017. And then moving forward, we are transitioning now that we've gotten so many people assessed for coordinated entry about how to make this system work for our community and really add extra supports in for the successes that we've had to keep those going. So we just did a soft launch of the call center that's open to healthcare partners this month. And then moving forward, we're going to continue to evaluate the needs of the call center and how we can broaden that to the community. Welcoming dedicated skilled assessors to larger shelters and access points, and evaluating the progress of those initiatives. And then moving forward really just means more of that evaluation of progress and seeing how we can realign our skilled assessors and use the new resources that have come to our community. This handout is also available for you to print and look at on your own screen.
And then we're really pleased to announce that 6 agencies who are hiring 9 full-time employees are just playing a very significant role in expanding access. So CSH, through the Continuum of Care HUD NOFA process, was awarded a bonus, if you will, an expansion to our supportive services only grant that we are then subcontracting with Catholic Charities, where 2 skilled assessors have already started at the call center. And Liza was referencing that soft launch, beginning with healthcare partners and small shelters being supported by the call center. Facing Forward has 2 brand new full-time employees who started yesterday, who will be offering coverage at large shelters to begin with, and then other locations floating as needed. Feather Fist, Franciscan Outreach Association, and Heartland Alliance Health will each have coverage at their access points through dedicated assessors that they hire to make it so that we have an access point on each side of the city that is Monday through Friday, 9 a.m. to 5 p.m. And FOA will also have an additional dedicated assessor for their shelters. And finally, the network, this is the agency that operates the domestic violence hotline for the city of Chicago, has a full-time employee, which is part of our work to expand access to housing through coordinated entry for people impacted by domestic violence and or human trafficking. And this work is done outside of HMIS as a parallel system. So thank you so much to these agencies, and more to come as assessors are onboarded and in the field.
And then Stephanie, we had a question emailed to us. Will skilled assessors who are being retired still have a way to mentor or be a part of the cohort with new people, new assessors?
Oh, I love that question. We couldn't do it. We just couldn't do it without people who've been part of this group. Really, we're rocking a it takes a village strategy over here. So to begin with, some people have been asked already if new assessors can shadow them. And so one of the ways that people are already helping in this regard is having dedicated assessors come and observe assessments. And that's not the only way, but I would love to put a shout out for that, because if you're willing to be shadowed, you could just let us know if you don't want to chat it in. Liza's email is also in this PowerPoint, but that's one of the ways that we need help from folks in terms of mentoring.
Thank you, Stephanie. So to just continue this conversation, I want to highlight what we're gaining in this transition period. So with these dedicated skilled assessors, we're able to standardize the hours for our access points, which are on every side of the city. So their hours will be Monday through Friday, 9 to 5. And this will ultimately increase access to coordinated entry. In addition, there will be consistent messaging to clients. You know, these skilled assessors will be trained as their full-time job to do assessments. They'll know the assessment like the back of their hand, and they won't have another focus. So and we will be able to train them a lot easier, and it's easier to manage than the current number of skilled assessors that we have. So the messaging to clients will be the same across the board. And then with that, improving the quality of completed assessments. It is more manageable to look at data quality and ensure that our skilled assessors have the access to the training resources that they need to complete assessments fully and accurately. Oops. One second. Okay. So in terms of communications, I wanted to outline what you can expect in the coming months. So in mid-September, all supervisors with skilled assessors on staff will receive like a generalized email from the Center for Housing and Health, and then a follow-up email with specifics about the potential plan for their organization. And of course, we do want to offer the option to have a call or a meeting to discuss what we are planning. But so we want this to be like a communication that goes two ways. In early October, we'll schedule these follow-up calls, and then there will be in-person forums for both supervisors and for skilled assessors. And then later in October, we'll communicate the strategy with broader COC partners and other partners throughout the coordinated entry community. And of course, that's not where it ends. This process will continue through the rest of the year and into 2020. So we look forward to these communications. If you have any follow-up questions, feel free to email me. I'm happy to answer any questions that you have or hear your concerns about what you have learned.
Great. So we just spent a lot of time highly focused on this exciting update around dedicated assessors being hired and onboarded and placed in the field. And of course, they are not the only people who will be completing housing assessments. It's just simply added system supports with others also who will continue to complete housing assessments who it may not be their full-time job. So we really appreciate everyone who participates. And we'll move into a prioritization update. So as a friendly reminder, we went through a process with the community where we developed a new plan for this year. And really the goal was to make an equitable path to housing for all of the subpopulations served through the coordinated entry system. And so the main focus of the 2019 prioritization plan is centered around the length of homelessness. And you can see that there are tiebreakers related to the unsheltered status, military service, vulnerability index score, and if people are impacted and their current homeless situation is in some way connected or caused by domestic violence. And within that, we also include human trafficking. So this picture is just to give a visual as a reminder. And when we reoriented the prioritization plan, we also reoriented the assessment to meet our matching criteria and guidelines for prioritization. And so a big piece of this has to do with understanding people's length of homelessness, even beyond what they may have initially shared if they were assessed in the past, to understand their chronic homeless status, as well as understanding their unsheltered status. Pass it off to Anna.
Hi, can you hear me okay?
Yes.
Okay, so I'm going to share some numbers. So people have been doing a lot of work since we implemented this housing history tool in March, which is the tool that we're using to gauge length of homelessness. So that was 6 months ago. Since then, 4,516 households have been assessed. 1,277 have been matched to housing, and 285 households matched through coordinated entry were housed. So that's pretty awesome. You know, that's part of the whole community effort, but really the skilled assessors have been working very hard. So I think people can give themselves a pat on the back for that. Let's see if I can click to the next slide, or you guys can click. Okay, so currently total on the one list is almost 10,000 people. Not assessed are 4,330. And then of the assessed with the housing history tool is almost 3,000. And then without the housing history tool is 2,400. And many of you know the housing history tool is required because we implemented that prioritization in March. And so this is what we're using for length of time homeless. And since that's what we're using, we needed a tool, and this is what it is. And so we've got, you know, about half the people who are assessed that have the update that is needed to be matched. So you can go to the next slide. Okay, so then this just shows a visual of the people that are assessed that do and don't have an update. So if you look on the right, the blue are the people that have been assessed. The whole thing, the whole pie chart is people who've been assessed. And then the people in the blue are people that have housing history tool update, so they're ready to go to be matched. And then the green people are not in a project, so they're only enrolled in coordinated entry. And then the pink people are people that don't have a housing history tool update and they are in a project. So these theoretically would be the easiest to target because we can get assessors at those projects to track them down and we can do the update. So yeah, so then most households requiring a housing history tool update and are in a project are in one of 8 projects. So again, we can really target who we're talking to and we can provide those supports. So I think that is it for me.
Thanks, Anna. So for us, it really matters where we're going from here. You can imagine on day 1, 0 people had a housing history tool, and now there are thousands who do. And yet we still have a ways to go to help everyone to have access. And so wanted to spend just a little bit of time talking about what we're planning and what we need help with and how we can all collaborate together. So agencies have received reports with HMIS IDs for who requires this update, and these will continue to be sent to providers. That's most helpful when the project both has a skilled assessor and the project does not have quite a large number of people, but it's not helpful if either of those are not true. So dedicated assessors will offer supports. As an example, I think you could see it from that last slide that most people in a project who require this update are in one of 8 projects. So we can see who needs help, and dedicated assessors can help these shelters to catch up. Also, the dedicated assessors at the call center have been calling youth who are not enrolled in a project. There were 118 youth who consented to share their information, not enrolled in anyone's project, who required an update, and attempts at contact were made for each of these individuals or head of households. Not all were reached on the first try, so the attempts continue as part of an effort to ensure youth who are not attached to a project are still outreached to. And one thing that we're finding as we work on this with you is that some people haven't been found for this update since March. So there's some work to do around projects exiting people who appear to be active and simply as though they're missing this update. And really, it may have been several months since anyone has seen the household, and they just need to be exited from a project. They may not be active as the way they appear to be. So that's just a little bit. There'll be more to come on this, but we really appreciate everyone who's completing updates and projects who are opening up your space to dedicated assessors to come and do this as well. The next piece that we're going to start to talk about are transfer policies. And wanted to start with just a big shout out. Can I get a woo-woo? I heard that from so many agencies. I appreciate that there was a call and response. You were muted, but we felt it. The transfer work group was just a wonderful group of folks who came together to look at how we could improve and refine our transfer policy. And this is an attachment.
Yep, this is an attachment. As Stephanie mentioned, the transfer work group met over the summer multiple times, and policies were created, and the leadership team gave feedback, and they were updated again. And recently in August, they were approved by the leadership team. So you'll see the approved policy as a handout. Please don't worry, we have not rolled this out yet. The coordinated entry implementation team is working on the logistics and on the back end to make sure this is as streamlined as possible. And we will then communicate with providers about how you would go about using the new transfer policy. As like a brief overview, we spent time looking at the internal transfers and really making that a more streamlined approach within the same model type transfers. And then external transfers, a new prioritization has been created, new procedures for approval depending on the type of transfer request, and some additional required documents to make sure that we have that up front so that the housing program that is accepting the household has the ability to hit the ground running with that household and not spend a lot of time working on getting the documents transferred.
If you're on the green line right now heading to meet a client and you can't access the handout in this moment, we would just want you to know that it will be available for you, and also that there will be like additional communication sent. You'll be invited, anyone who would be in a position to request a webinar, request a transfer, I should say, will be invited to a webinar that will be recorded as well as to what these new processes will look like. But we're really excited to see this improved policy. So thanks to everyone who was involved in crafting it.
Great. So I want to talk briefly about our accountability plan. So as you can see, we're all accountable to each other. Stephanie added a nice visual around great teams that communicate freely, disagree respectfully, push each other towards excellence, and hold one another accountable. So throughout the year, we've been working with various work groups to come up with an accountability plan. And this is a really brief overview, so it isn't meant to go into all details about it, but we did identify that there's accountability needed at multiple different levels in our coordinated entry system. And so if you look at the visual that's on your screen, you should look at it as rows. So the coordinated entry system as yellow, that's our overall coordinated entry system. That's the health of our system. Is it funded accurately? Do we have the right policies and procedures in place? Are they being updated accordingly? The next row is in green is our system facilitation. So in Chicago, our coordinated entry system has multiple partners that are helping lead the work. Some COCs just have like one agency that does everything, but for Chicago, we have coordinated entry partner coordination, matching, outreach coordination, and HMIS. And so each one of those system facilitators needs to be held accountable to what they are supposed to be doing for our system to make sure that everything is operating accurately. And then in Chicago, we've also identified, if you move on to the blue, we've identified core roles. I think as we continue to expand and modify coordinated entry, more core roles could always come into play. But for right now, we have system navigators, access points, and skilled assessors. Those are core functions that we've determined to be vital to our coordinated entry system operating and in compliance with our HUD regulations. So those core roles also will have some accountability plans in place to ensure that we're fulfilling what we were set out to do. And then the orange row is our housing providers, our drop-in and street outreach, our shelter providers. These are a direct line. And kind of as we talked about earlier in the presentation, a coordinated entry doesn't work without a partnership and without collaboration of our entire system. Typically, our orange row isn't always necessarily getting funding for coordinated entry, but they play a vital role in ensuring that our data is accurate and that those households are being connected to coordinated entry effectively. And we want to make sure that we're helping with the communication and consistent messaging so that each row has the same information. So as you can tell, this is no easy feat to hold everyone accountable for all of the different moving pieces, but we're trying to start the process of doing some accountability plans for different buckets that are in front of you. So the one that I'm going to talk about today is the bottom left corner of housing providers, the little orange bucket, but we have some accountability plans for other buckets that we're working on as well. So for housing providers, We have identified some main goals to support projects with coordinated entry to ensure some consistency in our system of how agencies and projects participate in coordinated entry, and also to help address and resolve performance concerns related to either our written standards or policy procedures and various outcomes. So what we're launching is coordinated entry technical assistance, which will include an online self-assessment that the project can fill out, followed by an on-site visit at your project, where we will review that assessment, also review data, and develop a collaborative technical assistance plan. And we expect for this to look very different depending on which project model type you may have, what concerns or areas of need you may have with coordinated entry. But we're really looking forward to starting this process and really learning from each other and finding where there are other pieces that we can hold each other accountable and inform this overall accountability plan. So types of the technical assistance that this may include is formal or informal discussions, referrals to training or special or tailored training sessions for your staff, referrals to written articles or resources. We often find that we have something that we've put in place and maybe rolled out, but it's not always easy to find. So we have things already in place that might be helpful that we just want to make sure get in the right hands. We also believe that we want to get some additional feedback on drafted or revised policies or policies that have been finalized but maybe just aren't necessarily working with the intent that we had. And so we're always open to making those improvements. And then if necessary or if possible, we would do some referrals to other content experts within or outside of our COC. The technical assistance, the goal is that we would be able to do the technical assistance on site during that on-site visit, because we would have some communication prior through that self-assessment. But then on site, we would develop that written TA plan, and All Chicago would then be sending that back to the agency to make sure it looks right. We will dedicate the following 3 weeks after that on-site visit to try to provide as much of the TA as possible. We know that it's most helpful to get it as real time as possible. But we also want to just be transparent that if TA cannot be provided in that time frame, that it'll still be scheduled for a future date. And one thing in regards to if it can't be provided, it's probably because it's a bigger system need and we need to work with our coordinated entry leadership team or seek additional support to make sure that we can get the right TA offered to that project and maybe even to the larger community and not just to that one individual project. So I know that was a lot. The handout, the accountability plan protocol is a handout that you can download. You will see that there's a lot more details to the plan, and my email is on here if you want to email me with any questions. We are likely going to try to do about 5 to 10 visits by the end of the year. And we're actually looking for housing providers to request this technical assistance site visit by using this form. And this link should be live in also the handout of the slides. It's a PDF, but you should be able to click it. If not, we'll make sure to send it out to the people that have registered for this webinar. And this is just a quick form to say, hey, I'm interested in receiving this TA. The deadline to submit the survey is October 18th. It might feel a little bit of a quick turnaround, but we do want to start the visits in October, and we've already heard from some projects that they're interested in receiving this TA. So we do think the slots are going to fill up quickly. So if you think you have a project that wants to be considered, please fill out that form as soon as possible. Of course, we will continue that into 2020 as well, but we want to target and get these going. Great.
If you haven't yet had a chance and you have any feedback or questions, points you would like discussed during this webinar, please find your way back to the chat. Check out a few of the interesting things about other people if you haven't made your way through that list, and then chat in any questions you might have. And Anna is going to MC our chat box for us and go ahead and share.
Yeah, and it's easier. I actually don't know what it looks like from your perspective, but if you put it in the questions box, that's easier than the chat. But one of the questions is it the expectation that the additional skilled assessor will replace the skilled assessor's individual agencies? Since so many have all been suspended, why couldn't those existing staff get the training that would enable them to do the work instead of hiring new people?
So currently there are about 130 people who play the role of skilled assessor. In the past, we've had upwards of 250. And it isn't that the goal is to have zero. By all means, we're very grateful for the 130 people. It is our goal to expand access and expand coverage. And one thing that we've found is that there are a few places in which we're struggling to have equitable access for people facing homelessness without dedicated assessors. So just to give some examples, we've really been at a loss for including people who are in domestic violence shelters, for including people who are cycling through hospitals and can't access a physical location, but could be engaged in the hospital, such as with their social worker and over the phone. And in particular, at large shelters, when people are in the evening and then out in the morning, most people within our continuum of care have standard working hours, and we really do require folk who will work in the evenings. In some cases, very early mornings. And so we couldn't quite expand access without having full-time staff. It initially was our goal to have full-time staff, and we didn't have the funding. So we went ahead and rolled out coordinated entry with this beautiful coalition of the willing. And in many cases, there are people who have been assessors this entire time who will continue. In other cases, as an example, there have not been assessors at PGM, at the Pacific Garden Mission, and there's a sizable population that travels through PGM. So that might just be one example of where we're actually not replacing anyone, we're only adding. In other cases, we're also adding without subtracting. But there may be some projects where the assessment burden is so great that people will now be able to get back to the job they were hired for and use some system supports in place.
Okay, so that question was Sherry. This next question is from Erica Ernst. We have CES assessors on 2 different teams at the night ministry? Please, will Featherfist be doing the street CES? Is the plan to eventually have entry points outside of business hours? You kind of just answered that, but yeah.
It's worth bringing up again that street outreach is an incredibly important part of this strategy. There are probably about 50 people playing this role, and in some cases we need to add to street outreach, in particular overnight and downtown.
Yeah, and like I said during my portion of the webinar, that this is a conversation too. If we recognize that there's a gap in access, we want to open that conversation and talk about what some solutions might look like. We're not trying to present this as decisions that have already been made, rather a conversation to hear from you and learn what our community needs.
Okay. Who all receives the updates of who needs the HHD housing history tool? And that's from Betsy Carlson. Or I guess who all received the updates of who needs the housing history tool?
So skilled assessors who may have missed the housing history tool with someone that they had completed an assessment with, or that had done an assessment with someone before the housing history tool was rolled out, or if they have individuals enrolled in their program who have yet to do that update, would have received an email from Anna with the HMIS numbers of people that need to have that housing history tool completed.
Mhm.
One thing that's kind of interesting is that the vast majority of projects have about one person, maybe 2 or 3. So, and then some projects have hundreds. So it's not, even though it's a very large number, it's not as widespread as a challenge as you might imagine when you hear the number. There are about 8 programs where if these 8 programs had the support that they needed to help with updates, that number would really quickly go down by about 1,600, 1,700, something like that. So we are committed to spreading the message beyond skilled assessors and to supervisors and to program managers, anyone who's directors, anyone who's interested. And for most projects, it's one person who requires this.
Okay. Could you describe the vulnerability index? I would like to have an understanding so I can explain it to my clients. That's Sharonda Peck.
That's Sharonda. Can I call you later? Can you put your number in? That's a great question, and I'm not sure in this time frame I would do a beautiful job.
Okay.
But there's just on the very brief, and I'd be so happy to talk more later, there are 3 indices. One is for single individuals that's highly medically based, such as what medical conditions a person is impacted by and hospitalization and hospital usage. There's a family vulnerability index, which is more so focused on the overall wellness of the family. And while substance use and mental health is included, less of a medical component and more around questions that might pertain to if the children have particular needs and care of the children, if the family is currently engaged with or has been with DCFS and pieces like this, and overall family wellness. And then there's a youth vulnerability index that primarily focuses on indicators that came out of a study in California with Dr. Eric Rice that looked at if youth on the street or in shelters would be likely to still be facing homelessness 5 years from now without a permanent supportive housing intervention. And so those questions for youth deal more with if they've used marijuana, at what age, juvenile detention, and other pieces more so focused on that population. So it's the very quick summary. Happy to talk more later.
Okay. Will we be deleting the question about connecting youth to employment services until the resources are actually available? And that's Angela Sidney.
You know, there's a really exciting update that I'm sure is not ours to make. I'm looking at Renee, but it seems to certainly be public. The Chicago Jobs Council posted a full-time position, and they started a pilot and with a student intern started to collect data on who would like to work. One missed assumption in this universe is that people don't wish to work, and this data has demonstrated, oh, like people do wish to work. People on SSI wish to work. Lots of people do. Lots of people wish to. It's a meaningful activity. People want to contribute. People wish to have an income for all kinds of reasons. And while they could or they couldn't keep up at an intern level with this, the position that they posted for a full-time person to lead this employment work forward, and their new acceptance into an award puts them in a great position to take this to the next level. So I don't know the answer to the question about like how the assessment will be impacted, but just to say there's actually some exciting news about more supports for people who wish to work getting connected in that way.
Okay.
And we are working with the employment and income line of work to talk about those questions and those next steps. So it's a really great question, and the timing will be coming soon.
Okay. Catherine Wilson asks, is there a plan for providing targeted referrals to safe havens through skilled assessment and through the one list?
There is a plan. So the people who are being connected to safe haven projects, such as the ones operated by Thresholds, Heartland, and Deborah's Place, are people who have been observed for their assessment, meaning instead of completing a standardized housing assessment based on the level that they're impacted by their persistent mental illness, they've been observed, and the observational assessor has recorded answers to a different version of the assessment based on these observations. So this is a population that's targeted for safe havens, both because of their persistent mental health condition, also because they couldn't go through the regular process of completing a standardized housing assessment. Perhaps they've been engaged on that topic multiple times, but it simply wouldn't be possible to sit down and answer questions. And so that cohort is the group that's connected in that way. And Deborah's Place and Thresholds, both of these agencies, I believe Heartland in the past, have been completing these observational assessments with people that either they were already in connection with on the streets or through referral. And the Center for Housing and Health has been playing a role in ensuring that when people can't be assessed, such as in a shelter or outdoor setting, that they can be connected to an observational assessor.
Mm-hmm. And there's a couple questions about requesting an assessor or requesting to become an assessor. If you could address that.
So we're not currently onboarding huge cohorts of assessors, though we will look at specific requests and hear what why you feel that you need the extra support. So if the people that requested those skilled assessors want to send me an email, I'm happy to have a conversation about that.
Mm-hmm. One example would be your intake worker who has been doing this left. You have a new staff person taking over that position. We know that comes up from time to time, so just want to offer that as one of, I'm sure, multiple valid reasons why this would be needed.
Paviela Foster asks, how will we know when these skilled assessors will be available on a daily basis, and like where and when they'll be? Every day.
Yeah, so we don't have all, assuming you're referring to dedicated assessors, we don't have all 9 hired yet or onboarded. So, but we absolutely will be communicating with the larger community these schedules once folks are in place. We are starting the 2 folks who are with Facing Forward at Olive Branch, PGM, and just 1 day a week at Cornerstone. And that will expand out beyond, but that the floating assessors will begin in those places, and then we'll absolutely communicate when the access points are Monday through Friday, 9 to 5. So this is upcoming by October. This is in the near future, but it's not today.
Gladys Carter asked, have you identified which agency will come to the DV shelters to assess clients, or are they going through the network to be assessed?
That's a great question, Gladys. Yes, so there's one full-time assessor who was hired. I don't know if she started. So either just started or will be starting soon at the network. And even though she offices out of the DV hotline, she will be mobile to come to domestic violence shelters. So once we learn a little bit more about her start date, and work through the onboarding and training, then the network will be communicating with all DV shelters. And there's also a human trafficking transitional living program that will be involved in this as well. But through the network. Thanks for asking.
Arcadia Ram Frank asks, how are more assessors useful if there isn't more housing?
It's a great question. So one thing, I kind of want to go into a couple different places with this, and Renee and Liza and Anna are welcome to chime in. One piece that we're working towards is refining the assessment itself so that it puts us in a place where we can learn what people's situation is without putting people through a traumatic long assessment experience that results in nothing. And so you will hear more because we'll be doing some focus groups and also having community check-ins in person in October on the assessment itself. I want to mention that because the idea of why do we need to have everyone assessed sort of relates to, wow, it's a long thing to do if it doesn't come to something. So could we learn quicker who will be prioritized for something and then spend a little more time with those cohorts? The second piece is that we're actively working with the Continuum of Care Action Agenda Pipeline Work Group to see how we can connect coordinated entry to a broader array of housing. For example, public housing where coordinated entry can refer directly into, and project-based rental assistance programs only funded through CHA and not yet connected to the COC. How can they be onboarded? As well as how coordinated entry can be a referral list for the statewide referral network for people who have the ability to have ongoing services through some provider, and affordable housing as well. So our goal isn't only to focus on people who meet chronic criteria or something like this for a specific set of housing resources, but to understand our more full population, to do it in a more efficient and more trauma-informed way, and then translate that into a greater number of people placed into housing because of the assessment.
Okay. Megan Wickman asks, how will HUD's evolution to include Category 2 impact CES prioritization?
That is a great question. Because that was in the NOFA renewal this year, we know that we have some time to wait until that's in place next year. We'll be looking for some additional HUD guidance because a lot of communities and COCs will be asking similar questions along with other coordinated entry systems. So we haven't focused on that for 2019. Our community needs to make some decisions as a system around how we'll work with that. But we do have that kind of earmarked as something to be following up on.
Okay. We had another question about the vulnerability index. I don't know that you want to go into that, but she says, that's also Megan, can you remind me what the role of the VI questions for youth is now that we have new priorities have been rolled out?
So the VI is still being used as a tiebreaker. There's a slide earlier in the presentation that shows that if after length of time homeless and unsheltered and veteran status, the VI is used to help us determine who might be next matched for projects. So there are some that current use right now.
Mm-hmm.
We're also really very much in the space of wanting to hear more. If anyone wishes to chat in, and we promise not to read it all out loud, but it's fine if you wish to chat it in, like just to the organizers. If you're willing to share any feedback at all about the VI, about the assessment, this is, I promise, not the only place to do it, but if you're in the mood, we're really seeking input on that. And the center will be leading some focus groups, both with people who are experiencing homelessness or were assessed through coordinated entry, as well as with staff. And there'll be other forums as well to give your assessment feedback. But for anyone asking a question about what is the VI and how are we using it or why are we using it, these are great questions. If underneath these questions you have thoughts, we would love for you to share them.
Okay, here's a question from Eric Buckles that I might be able to answer. Does the skilled assessor who makes the updates to the housing history tool become the skilled assessor contact, or does the initial skilled assessor remain? And so if you're going in to make an update, you would overwrite the previous assessor's information, and then you would be the person to contact since you were the most recent person to have had contact with that client. Anything else to add, Liza or Stephanie?
No, I think there's been some misinformation out there that you're not supposed to input your own information when you're doing an update, but in fact, please do that. We want to contact the most recent skilled assessor when we're making matches.
Mm-hmm. And I believe that's it for questions. Yeah, I think we're good. If we didn't answer your question or if we've still got a couple minutes.
Well, we would just want to say that we so appreciate your active participation and don't expect that this is the best way to be in conversation with everyone. It's just one way that helps us reach a broader audience all at once. So if you didn't feel comfortable chatting in a question, when you receive the PowerPoint and materials. You'll see contact information for follow-up, and we wish to just continue to be in conversation with you because we recognize that coordinated entry will require continued refinements with your feedback. So your feedback and participation is just sincerely appreciated.
Yeah, and I should just add, actually, there are 2 more questions that might be relevant. So are these, I don't know if we answered that, are these skill assessors, will they be traveling to different sites? So are the dedicated assessors going around to different sites?
Yeah, so there will be 9, and of those, we'll have 2 floaters that will be going to different shelters. As of right now, they are scheduled to go to 3 different shelters, but we will be adding to that as we see fit. And then the person at the network also has the ability to be mobile if needed.
And then Gloria West asked, will we have access to the yeah. Will we have access to the PowerPoint? Yes. Okay. Well, that's totally available to everybody in the handouts, right?
Yep.
Okay, cool. Okay, I think we covered all the questions, and there might have been a couple details that we didn't cover just because it's not broadly applicable here, but we can answer them individually later over email.
So before we go, Arcadia is having a tag sale on Saturday. If you didn't read that in the initial get to know you function, you can scroll back up to the top for an address.
Yeah, so thank you everybody so much for taking the time to listen to us today and learn more about the coordinated entry updates that are happening. As we mentioned, the handouts are in here that you can download. If you have any trouble, you can email us and we can make sure to get those to you. Also, this webinar has been recorded, and so we promise to not listen back to it ourselves because listening to it is a terrible thing. But if you have staff or other colleagues that you want to share this with, the recording will be in All Chicago's learning management system as a course under the coordinated entry check-in. So the recording can be listened to there. And so again, thank you everybody for spending time with us today. Bye.
Yeah, bye. Thank you, everybody.